Welcome to this Africa Travel Week Connect Masterclass. I am thrilled to be able to bring this particular topic into the mix because more than the currency of trust, they're actually the framework within which we can relax our travel restrictions and have been able to relax our travel restrictions. Centered to that trust has been the development of health and hygiene safety protocols for the industry, by the industry. And driving this process on behalf of the Tourism Business Council has been the CEO of FIDHASA, Lee Zama, who joins me on the call today. Lee has over 25 years working experience across different industries, such as the services sectors and the hospitality and food businesses, where she covered a variety of leadership roles in sales management and operations, national key account management, and general management. Also joining me today is someone I've had a great privilege to work with over the last few months. She's not an economist, she's a tourism specialist. Her name is Jillian Saunders. I'm sure you know her well. She was also formerly the special advisor to then Tourism Minister Derek Hanekom. She's currently working as a consultant to the Tourism Business Council, and she's been working on the TBCSA's Public-Private Growth Initiative, the Tourism Growth Strategy, and working very closely with the Inbound Recovery team to help us get our borders open. So these two ladies are very, very important ladies in my life and have been over the last few months. I'm very privileged to have them in the room with me. Welcome, ladies, and thank you for joining me today.
Pleasure. Nice to be here, Natalia.
Right. So I'm going to start with Lee, if I may, and that's around the nexus, the health and hygiene protocols that are this currency of trust for the traveler. Tell us a little bit about how those protocols were developed, Lee.
Good afternoon. We're an industry-wide initiative.
Ooh, Lee, I think your signal's a little bit...
Yes. In fact, it was up.
Sorry, Lee, your signal's a little bit funny.
I think, yeah, let me reconnect.
Okay, great. All right. Well, maybe I can kick off with Jillian.
Give some context.
Yeah, if you kick off, that would be great.
Yeah. So Lee was very involved, and the TPCSA created a small subcommittee of people from different subsectors in the industry. And 2 or 3 processes happened, but it was very widely consulted. First of all, SATSU in particular ran a series of webinars with different subsectors and brought in all the ideas that the people had. We got hold of, for the first version, we got hold of all the World Health Organization documents. And from those webinars, which were very consultative, we pulled together a first set of protocols. FIDHASA was involved. They had done quite a bit of work on hotels. Some of the big hotel groups were involved. And then we didn't stop there because that was done in quite a rush, literally at the end of April, early May. We then went on a bigger, larger consultative process where we created, I think it was 7 or 8 subcommittees for adventure, for car hire, for tour operators, for large accommodation establishments, for small accommodation establishments, for attractions, for activities, if I didn't say it already. And each one of them went away with the protocols and came back and said what they would like to see more, what they think their industry should do. And we then expanded that document, and they are protocols that cover the entire tourism value chain. And sort of, they have everything that complies with government's directions in there, but they also have a lot of guidelines which can take you into the detail of how to apply what you need to do.
Yeah, I mean, I think when we talk about protocols, it's a very unsexy topic, isn't it? But can I just tell you, as a traveler, having flown through Cape Town International Airport this morning, I was absolutely astounded at the level of protocol adherence by the airport and also by the airline in question, and the extent to which they were ensuring the safety of guests and staff. There is no question in my mind that you are safer traveling than you are going to a supermarket, just based on that experience. So, you know, if I can, let's see if Lee's signal is a little bit better. Lee, shall we try again?
Yes,
okay.
We can try.
Okay, so as I've just mentioned, I felt really safe and secure as a traveler. Perhaps you could just unpack the rationale for those protocols. Why is it important for us to have those protocols in place? And as tourism stakeholders, to make sure that we put those protocols in place for the safety of our staff and for our guests.
Thanks, Natalia. I just need to add a little bit from what Jillian stated earlier as well. In this wild consultation, what we were very deliberately in recognizing was the fact that small businesses in the sector, they have to be considered. We didn't want to write a document that covers big business because there are nuances that reflect for small businesses. So that is actually a very important thing to note. The importance of the protocols in the sector, one is we want to mitigate the risk of COVID spread and at least protect our industry for the stigma, which unfortunately we've kept for a bit while. And we needed to ensure that we open our sector in a safe way. And I must stress again that our sector in most operations that we do, we already work in a very hygienic, very safe and for guests because work that we do on a health and safety actually guide the normal work that we do. So the additional work that we've done to mitigate the spread of COVID by putting together protocols for us is somewhat a minor adjustment. But that being said, the general understanding of COVID right across the world, that you just need to ensure that they sort.
We're not winning with Lee's signal today, I'm afraid. Sorry about that, folks.
And the sanitization of areas. Thirdly, we need to ensure that the staff is trained and there's provision of the right PPE and so forth. Those are the basics that makes the protocol what they are. And the application of those is really, really a minor adjustment for the industry.
Yeah, so it's not actually a big stretch because we were already an industry that took to heart the safety, hygiene, health of our staff and of our guests anyway. So this is just a kind of additional lens, if you will, to making sure that people are safe. There, Lee, you've just touched on it, that it needed to be fit for purpose for small business and for big business. And there've been a lot of different protocols that have circulated. There've been a lot of organizations that have put together their own protocols. Perhaps, Lee, if I could stick to you, you could let me know why the Tourism Business Council ones are the apex ones. Why is it so important that those are the ones that we follow as an industry? Lee? Yeah, so just wanted to know the Tourism Business Council protocols, why are those the apex protocols? There are lots of protocols that are circulating at the moment. Why is it important to have a standard, if you will, for the industry? Definitely not winning. Jillian, do you want to take that?
Well, I think the first thing is that there's lots of protocols going around. There are international protocols. There's different. So let's say the African Adventure Activities Association, ATA, anyhow, they've created protocols for all the different adventure activities, and different people have created different protocols for different aspects of the industry and subsectors. We, as the Tourism Business Council, said we're the entire industry, and I really think we did get people trying to come to us and saying, "But your protocols don't do this, or do this, or do the other." When we looked at it in detail, our protocols covered everything. And the thing that made them extremely appropriate is that we canvassed broadly and consulted with every subsector of the industry. So when the protocols were challenged by one particular person, and he said, they haven't been developed properly, a person who was a tour guide and an adventure operator said, well, my association has not spoken to anybody else. It's the only ones we've had inputs into. So these are the actual only ones that cover our industry properly. And I think largely all of the not largely, the accredited associations, the members of the Tourism Business Council, who are the largest leaders of the different subsectors of the industry, have all contributed. And within that, their members have contributed. So these are applicable across the industry, and they're extremely comprehensive. They abide by international requirements, which are not as detailed as ours in many ways, and they also follow all the government directions. And when you operate in tourism, the thing about tourism is, and I don't know if anybody's thought about this, I've been the person who has to think about it, in the national government ministries, they keep bringing out directions for different ways that we can do things during COVID. The directions that apply to tourism come from the Department of Transport, the Department of Tourism. SPAs, by the way, are under the Department of Small Business Development. Then we have Environment Affairs, Forestry and Fishery. There's a lot of directions there. There's directions in Sports, Arts and Culture. So you have to look at the directions across at least 5 ministries to understand what you need to do in tourism. I do not think that anybody else's protocols keep up with that and look at all of that. Ours are very comprehensive, detailed, supported by the entire industry and canvassed widely with the entire industry. So they're certainly the best ones. And we are the apex industry body in South Africa. If you look at the Tourism Business Council's membership, we represent about 15,000 different businesses in the country. I don't think there's a mandated group that's remotely close in terms of, well, there is in terms of tourism. So this is where the protocols live and are alive and are up to date, and will keep your guests and your staff safe.
So, Jillian, I know the Tourism Business Council protocols have received the WTTC safe stamp, and I know that there's an element of the Tourism Business Council being able to issue that safe stamp to businesses in South Africa that comply. Is that correct?
No, that's correct. So we submitted our protocols to the WTTC quite early on in the process when they had the safe travel stamp, and they were very complimentary. And we immediately got accreditation ourselves, and we explained to them that we were the tourism industry body in the country. And they said, okay. And then they came back and said, okay, right. We didn't even ask for it. They said, we will make you the people who can give out the accreditation with your accreditation. So anybody who says they are adopting our protocols can also have the WTTC safe travel stamp at the same time. Now, I think perhaps we do have to talk about the fact that our protocols are self-regulatory, and it's either by peer or customer review that we will make sure that people abide by the protocols, which is the way the WTTC safe travel stamps work as well, around the world as it's been adopted. It's a self-regulatory travel COVID guidelines.
So the protocols are just one element of this larger travel safe, eat safe program. And I see Lee has rejoined us. So let's see if her signal is a little bit better, since she's really is the driver behind the travel safe, eat safe program. Lee, do you want to just tell us a little bit about what some of the initiatives are related to this travel safe, eat safe program? Things like the app, for example, any other elements that the industry needs to get behind? No, still not. Jillian, you and I are going to have a conversation.
Well, luckily, although I wasn't there, I was just here. Really.
There, I've got you, Lee.
Can you hear me?
Yes.
Can you hear me now?
Yes.
I'm so sorry. I was speaking to myself earlier and really making serious point. But anyway, I'm so sorry. But answering you, Natalia, under these strained conditions of the reception, is that we've developed a travel safe, eat safe app, which is what we call it. And in line with what we're saying there is that South Africa is travel ready. You can actually come to our establishment, you can travel, and you can eat safely in any of the tourism establishments, because we've put together protocols to ensure that our clients and customers are actually safe to come in. The app provides a very wide support for the industry, that instead of using the paper system, the operators can log all information that they need to take for their guests, whether it's temperatures or any other information that needs to be taken in terms for the track and tracing system that could be logged into the app. But more importantly, I think the greatest point that we wanted to put across is that as an operator, and you're respecting your operation and you're respecting what the industry is trying to do, go into that app and pledge your support for the initiative of making. Basically, you are saying, I've trained my staff, I have ensured that there's social distancing in my operation, I've ensured that there's sufficient PPE and there's sufficient whatever my staff need to be able to operate safely. It's important because we need to safeguard our employees as much as we're trying to safeguard the country at large. And the second part is that we've created another app which is free for people to go in and train themselves about COVID, and they can get certification. And it has 5 modules, which it's really, really an easy way to navigate it through and get full certification that you at least been trained and understand the application of COVID within the tourism space.
Okay, so we've got the app, we've got the training element. There's also a PPE marketplace, I understand, where you can go and have a look at a full list of suppliers that can supply PPE, which have been endorsed. And
Absolutely.
that app is available for download already, Lee?
The app is available, the training app is available for download. It's called COVID Training and .journey.co.za. It's available for anybody to go in and train themselves. And then the app to register and sign up late is called Travel Safe Eat Safe.co.za. You can get this app if you go to any of the association. It will be on their website. Otherwise, the Tourism Business Council website will have all these links as well.
Okay, great. So the Tourism Business Council, and we'll also send the links out with the recording of the session so that you have access to it. I can see Chelsea has kindly thrown the links into the chat for us as well. And don't forget, there's a Q&A folder. If you have any questions for our panelists, please send those through. Let us know what's on your mind, and we'll pose those questions once we've gone through the list of questions that I've got for Jillian and for Lee. So the uptake in terms of the protocols and downloading the app, maybe I can stick with Lee if her signal is okay. How are we looking? You know, how's the industry getting behind this? What support are you needing from the industry at large?
We need to spread the word a little bit more. We're sitting, Jillian, maybe, I'm not sure what was confirmed this morning, this morning's meeting, but the last I checked, we're just over 1,000 registered businesses on the app. We expect to see a bit more, so we still need to spread the word and let business operators that they need to register their businesses on the app.
Perhaps I can go through to Jillian and just ask the question around barrier. So would one of the reasons be not to download the app and not to get involved in the Travel Safe, Eat Safe program because it's just too damn hard or it's just too damn expensive? Just tell me how accessible this Travel Safe, Eat Safe program is for someone like me who runs a small business. You know, I have 10 staff members. Is this something that I can feasibly do?
Absolutely, Natalia. And as Lee said, when we developed the protocols themselves will deal with small to large businesses. We made sure that it was friendly for small businesses, and the app is friendly for everybody. So there is two versions. There's the free version, which has a slightly more limited functionality. And then there's a premium version, and I don't remember the amount, but it's not much more than a couple of £100 a month, as I recall, to have the premium version. The premium version gives you more control, I believe, over some of your employee records and data, but it also allows you to track guests and start tracking your guests on the app. So the app allows you to manage your entire employee or all your employees in terms of their COVID status and the daily recording of their COVID status. So each time when they arrive and each time when they leave, their temperature, and then the static data, you only have to have it on record once for them. And the same with the guest. If a guest stays multiple days in your establishment, you only need to take their temperature and ask them, have you got COVID symptoms every day? The rest is the same information when they checked in as to when they check out. So the app is absolutely simple. It's not hard at all. It really isn't hard at all. And then it's as much as you want to use it. In a small business, you might simply say that you're committed to the protocols, and you then get the accreditation. You get to be able to use it on your website, on your marketing collateral. At the same time, then you can carry on. If you want to manage your protocols by pen and paper or whatever system you want, you can carry on. So it's very, very flexible, but the app is very easy. And I want to just go back to the protocols. That they sometimes look daunting, but what the protocols do is they sort of make it easy for you. So say you're running vehicles, you're a tour operator, car hire company, a hotel that's got a shuttle service. It sort of tells you in simple terms, have you thought about all these surfaces in a vehicle that you need to clean when you sanitize surfaces? So you probably don't think about it, but it just lists it out and makes it easy for you to think. Or in a bedroom, did I think to clean, I don't know, the kettle and the kettle knob or the plugs or whatever, places people might have touched that we don't always think about for sanitizing purposes. So it's really an assistance thing to say, here's all the places you need to think about cleaning. Here's all the places you need to think about people touching and try not to have them touching. So if you're a big hotel, perhaps you can have somebody in the lift lobby who presses the buttons on the lift for the guests, so the guest doesn't have to press the buttons. Lots of little tweaks and ways of doing things better that are not, it's not in law. It's only to make it easier for you to keep things clean and safe for your guests and for your staff.
Okay, so it's a bit of a reminder. Lee, question for you, and I experienced that this morning on the aircraft. I know that our protocols, the tourism business protocols, don't extend to aviation, but what I did notice was very bad behavior from travelers, which begs the question. So we as an industry have put in place amazing protocols to keep people safe, and we're asking our tourism establishments to make sure that they own these protocols, but then you have this badly behaved tourist/traveler who's not adhering, not wearing their mask, not sanitizing, etc., etc. To what extent is it the responsibility of the tourism establishment to try and ensure that the traveler complies with the protocols that you've spent so much time putting together?
You know what? When a traveler is in your premises, obviously the responsibility to ensure that they actually behave in a correct manner does fall within the establishment, and it does take a toll, and it's quite a stretch for the sector. We've had some questions being raised in restaurants where people go in and they drink and they actually then totally forget about the application of protocols. It is something that we are very much in cognizance of, and we're trying very hard to to start having a program where we educate consumers. We need to protect our sector. We need to help the consumers to help us protect the sector, because if they come in and they start behaving in the way that is not correct, it does not bode well with what we're trying to do, and it's not good for the businesses to have themselves with the police asking them questions purely because someone else has come in and decided not to respect what the whole industry is working hard towards. So a lot of work needs to be done to actually assist the businesses by informing the travelers and to say this is what is required to do. So we need to do a lot more work, Natalia. You must say assist us to protect our industry. And secondly, we do need to enhance the message within our own systems, within the distributors of services and goods in our industry to help us spread the message as far and wide as possible.
You know, you almost want to have some kind of mechanism where you can report badly behaved travelers, although I know that will never happen. But I know, have been speaking as a collective about the need for us to put some form of complaints system in place, because this is self-regulated, in case the customer does feel unsafe or they feel that the protocols are not being adhered to. So perhaps, Lee, if I could still stick to you, and if you could let me know, is there going to be a complaints process? What is that going to look like?
Yes, the complaints process, we have it already, actually, and we have even an additional section, which is an assessment that a formal assessment can be done by anybody, through the app, and actually write out everything in detail. The complaints process is a much simpler one, where we ask, basically you can go in and click directly, say I'm in establishment XYZ. You can drop a pin in terms of geocoding where you are, and then simple have a drop down button that says, this is the issue that I'm seeing. There is no social distancing, there's no wearing of masks, or whatever issue that you're picking up. And if you want to write a comment or two, and then you send that right across, that it goes to a monitored email address, and we will follow up to find out what's happening. We'll speak to the local tourism authority to assist us, because this is not just a tourism establishments alone issue. We expect the government, local authorities to assist us as well, to assist the small businesses, especially in this case, where we've seen some of the issues being raised. But we do believe that that assessment tool plus the complaint section will assist us in helping those that might not be in totally 100% in line with what we say should be done.
I do also want to underscore that while we talk about the customer as a consumer, we as the tourism industry or travel industry, as travel agents or tour operators or DMCs, probably also have a role to play in terms of being the customers of product and asking of our establishments, of the products, of the suppliers that we support to be travel safe, eat safe on behalf of our consumer customers. So that's just a little point that I want to throw out there from myself, if you will. Jillian, I want to come to you and talk about this COVID tracking app that's been instituted by the government. And I think to a certain extent, people are nervous about downloading apps onto their phone because they think that perhaps their details aren't going to be kept confidential, or they're going to be spied on, or all the rest of it. The first part of the question is around our Travel Safe, Eat Safe app. Can you tell me that my privacy concerns are being adhered to, number one? And then number two, what is your view on this government COVID tracking app?
If I go to the Travel Safe, Eat Safe app, remember that is an app for business operators in the industry. It's not an app for consumers. Consumers can log on the website to log a complaint, but once you go onto the website and register, you download the app, and then you will be signing off. I mean, it follows all the appropriate privacy protocols in terms of the, well, I've forgotten what the name of the new act is, but so there's no qualms there, but it's really a business management tool, okay? So now government's app is a very, very different thing. And different countries around the world have tried to do contact tracing apps and with different degrees of success. And our government brought theirs out relatively late in the day, if you like, in terms of where we've been. But I did look into it. And first of all, a couple of people that I wouldn't say, that I believe you can trust their opinion. One is a lady called Emma Sandler. She's a very well-known social media lawyer in this country. She says she's looked into it and she thinks it's fine. Another guy who is an app, I mean, he's not an app accreditor, but he understands app development and he's given it a very thorough look through. I've read his article. But I think maybe just to say, the core system on the app is actually a Google-Apple system. Google and Apple, believe it or not, got together and said, in terms of the world's health requirements, we will produce this data capability. And they only give it to health authorities in countries. Nobody else can get it. And if I can try and explain what happens, because people say, well, it must be tracking me if it knows if I've been next to a COVID person. What happens is you get a unique ID, which is you. It's not your name, it's not your address, it's nothing, it's just an ID. And those IDs actually change. They make sure those IDs don't even stay static. So they're sort of like, it's like repasswording them every so many hours or whatever it is. And somebody else on the phone, and you have to have Bluetooth active. That's the one thing that might be to some extent a challenge. Bluetooth chews battery, but Bluetooth has to be active. And what the information that stores is anybody who was close to you, and I have to assume it's for the required 10 to 15 minutes, because if you're next to somebody for a short time, it doesn't count. It logs that as an instance of contact, not where it happened, not who did it, apart from the unique IDs of the two phones that talked to each other and said, and you can imagine there must be mega millions of these instances of contact, but obviously they can store it. And later on, if one of those, because then later on, if you test positive, you must go and tell the app that you've tested positive. Then it will go back in the last 10 to, I don't know how long, last 10 days, and it will tell everybody that you had a contact instance recorded, that they were close to you, okay? Or close enough to you that they should give it consideration to self-quarantine, basically. So it doesn't store any information about where anybody went. It stores information about two humans carrying a cell phone with the app on that has Bluetooth enabled, got close to each other. So it's an instance of contact, not an instance of location or where. So that makes it effectively, with the changing of the IDs and with the fact that it's only available to governments and to health authorities, pretty safe, I would say. And honestly, I think Google and Amazon and a whole bunch of other people know far more about us than this thing is ever going to know about us. So I think it's a good thing. The government has said in the regulations that they're going to require, well, no, the president said they're going to require foreign travelers to download it. It won't work for foreign travelers if the rest of the South Africans have not got a critical mass of people who downloaded it. So we as the tourism industry need to encourage South Africans to download the app and to use it. And I think it will help us, if we get to that critical mass of people using the app, it will help us as a nation, never mind our foreign tourists, to make sure that we minimize the ongoing spread levels of this disease or this pandemic.
To that point, Jillian, I know Tourism Business Council has been advocating for a full reopening of borders, just based on the fact that you have 58 million South Africans circulating with community-seeded COVID. Having a few 100,000 international tourists, whether they come from Brazil, the Bahamas, or the United States, is not going to make absolutely any difference whatsoever. Can you tell us a little bit why those protocols and non-pharmaceutical interventions are actually important in motivating for a full reopening of borders, no phased approach, essentially?
Yeah, so we absolutely advocating for that. We're not sure that we will get that because we know they've talked about high-risk countries and people from those countries being treated differently. But what we did is we were very lucky to be able to interact as an industry with some members of the Medical Advisory Committee, 5 members actually of the Medical Advisory Committee, not as committee members, as informed people who want to assist industry sectors in South Africa to reopen. And when we sat down and spoke to them and explained what tourism is, they said at the end of the conversation, well, there's no reason all the borders shouldn't be open. And their biggest single reason that we could say that is that we have protocols and we follow the protocols. Because what they're really saying is South Africans have got this disease and we're moving around the country. And by the way, some of the members of the council, of the advisory council, and some other commentators and scientists in South Africa are saying that in South Africa, maybe 12 to 20 million people have had this disease. And the same goes in other countries. But so many people have had it asymptomatically, but they've been moving around with the potential to spread it. So the protocol stopped the spreading of the virus. And the entire rationale for the Medical Advisory Committee members saying to us, you can open the borders, is because we have protocols and we are abiding by the protocols. So that when a South African moves around this country, whether he's just gone through a relative hotspot or not, or whether a person gets off a plane from Brazil or the USA, once they're in South Africa, it's the protocols that stop the spread, regardless of the nationality of the person moving around. And so that's why we as an industry need to stick to these protocols. We need to demonstrate to our government, to our local tourists, to our staff, but to our international travelers. And our international travelers, as the borders open just now, we need to be able to message to them that we have good, strong health protocols in place. They're going to want to know that, and they're not going to want their own press, for instance, to have gone around this country and found incidences where people were perhaps not following some of the protocols. So we need to make sure that we follow the protocols. There will always be people who don't. There will always be businesses that don't. But we need that tipping point or a critical mass of businesses that follow the protocols to enable this narrative, which the scientists are supporting us in, that you can open all the borders.
Yes, and absolutely viewing travel and tourism not through the lens of the pandemic, because we keep getting told that travel is the reason why the pandemic spread, essentially. So let's be the industry that explains to people why it's important to have protocols so that we don't have this pandemic spreading further.
Tony, maybe I can just comment on that, because I think, you know, tourists did take this thing around the world, but not just to South Africa. They took it everywhere. It didn't move without people because it's spread by people. And we're now at a level in most countries, even with a few of the upticks that some countries have seen, where we have to live with it. We are going to live with this. Maybe we'll have a vaccine one day. And we need to manage it till that point by following protocols. And that's it. All countries in the world are living with it. We have to live with it.
Yeah, absolutely.
You know, the tourist thing is now, the tourists also took all sorts of diseases around the world. That's what happens when people travel.
Absolutely. If you have any questions, please throw them into the Q&A. I see that there is a question there already, and that is a question I can actually respond to myself. The link to the guidelines and protocols are available on the Tourism Business Council's website, and what we will do is ensure that you have that link when we send through the recording tomorrow. So please just keep a lookout for the mailer, and you will have all the links, and hopefully get involved in the Travel Safe, Eat Safe program as well. Lee, if I may call on you, please, and that is the one thing you want product owners, suppliers, establishments to do today when they hop off this Zoom call to ensure that they are travel ready. What is the one thing? She is off mute. Lee, oh dear. Can you hear us? No. Okay, that's fine. I'll come back to Lee. Jillian, I'm going to call on you again.
Oh, register themselves. Operations in the country have done what is necessary to implement the protocol.
No, she's gone. Okay.
Totally.
It's fine. I know what she was going to say, but I'll call on her again when she gets back. Jillian, I know you're going to answer this question. The Minister of Cooperative Governance and Traditional Affairs said when she was unpacking the level 1 regulations last week, Friday, I think it was, I recall, she said, and I quote, "Every time you choose to leave your home, you make a life or death decision when you hear a statement like that, it's a little scary to think, oh, I should go out, get on an airplane and go traveling. Is it really safe to travel?
So if I can unpack that on two levels. The first is, with the greatest respect to our minister, I think that's a scaremongering statement. I do want to stress that this disease, even on the recorded numbers of cases, 80% of people have a mild experience of the disease or are asymptomatic of the people that get sick. And ones that go into hospital is around about 5 to 6%. And then the death rate, and now death rate in South Africa is pretty low, is around, I think it's around 1% or 1.5%. And it is a horrible thing because it does, people who have comorbidities, people who are older, it is a high risk. So if you have a comorbidity or if you're older, you're not making quite a life or death decision, but it's a higher risk decision to leave your home, okay? If you are not got those things against you at all, and especially young people, it is not a high risk decision to leave your home. And I know people say this, but you're going to die in a car accident more likely than you are from COVID. So I think the COVID scare has been a little bit overstressed around the world. And if I can also mention to people, you've heard a lot about flattening the curve. You saw the curve, there's a peak in the curve and there's a line here. Flatten the curve didn't say we don't want you to get COVID. It said we want you to get COVID later. All they're trying to do is make it go through the population more slowly. That is the idea of everything that we are doing, is that it goes through our populations more slowly so that that few percentage of people who need intensive care can get intensive care. We don't swamp the beds because it used to spread very fast. Now with the protocols, it's largely not spreading very fast. So if you want to go out to do anything, if you leave your house to shop, to go to a restaurant, to go to work, to go to your church or whatever else, it's equally as much risk as traveling, if not perhaps more risk. And maybe let me talk about domestic leisure travel to start with. Most people travel in their own personal car for domestic leisure, 76%. The average accommodation establishment size in South Africa is about 23 rooms. If you take the hotels out, it's about 14 or 15 rooms. Hotels themselves are about 76 rooms. If you run at 60 or 70% occupancy and the average stay in domestic leisure is 4 days, that means you might have all of 20 or 30 guests staying 4 days in an establishment, interacting potentially at risk of interacting with the other 20 odd guests and with the staff of the hotel. Not all the staff are on duty all the time. Not all the staff are in client-facing positions. If you go to some places like a supermarket, it's entirely different. A supermarket or a shopping center, people don't stay 4 days. They stay 30 minutes to 4 hours, depending on the nature of the shopping center. A large shopping center can have 5,000 people a day going through it. So, you know, risk is all relative. Everywhere must practice the protocols, but there is nothing. Travel is actually probably less risky than lots of other things we can do in our day-to-day lives. And so we mustn't be more concerned about travel than anything else. We must judge the risk, and it's more of your own health and where your own health sits. But otherwise, you can go out there and travel. I was in queues this morning, goodness gracious, to get my vehicle license renewed, because apparently it had to be done today. And there was 2 or 3 old people in the queues, old because they told me their age, 72 and 78. And saying, no, I'm out. I'm not going to let this thing keep me at home. And, you know, they were not bothered. We had so long. We had 2 hours to talk in the queues. But yeah, but really, if I can impress upon you, travel is probably in an airport and so airplanes have some of the safest air you can ever experience because of the high efficiency particle filter system, which changes the air and what it is every few seconds or minutes. And so the health experts on the phone call that I was on said, if you are both wearing a mask and you're sitting next to somebody with COVID, it's actually extremely unlikely that you're going to get infected on an airplane. And airplane air is the safest air you can have. You travel in private cars for a lot of travel. That's one of the safest places to be because it's the same people you're sharing your home with, I presume, in the car most of the time. So this notion that travel is dangerous is, we've got this bad rep of being higher risk. We're not higher risk, we're actually lower risk.
Yeah, absolutely. Lee, let's see if your signal's any better. Can you hear me?
Yes, I can hear you, Natalia.
Awesome. Okay, so you were busy telling us what the one thing is that you would like suppliers, product owners, establishments to do to ensure their travel readiness.
Well, we would like them firstly to register in that app, because the registration on the app will not only assist the tourism industry to be able to go into a particular area and provide the necessary support. Should there be a flare up, for instance, we could then in that case and say, where is the flare up? Why, how many establishments are registered on the app, and be able to understand and make a business decision on how we can support. And without that, it just makes it a little bit difficult. So we do need businesses to go and register on the app. It's a fantastic tool to have. And by the way, it's only 95 rands for a paid version, per property, to be able to upload all sorts of information, which is, that information is a great business tool for you to manage your business through this COVID, because we've seen in some establishments where they use paper system and they're carrying files. This is easier to dive in and be able to pick up information if necessary and be able to send to the department for whatever reason, because if there is a case, you know that you'll be able to provide that information to the Department of Health when they come and request it. So it's important that businesses register without any question. And we would like the businesses as well to, if you've trained staff, send them onto the COVID training online system for refresher courses. And we just need the businesses to be knowledgeable about what we do. You can never train people enough in this type of work. We're going to be with COVID for longer than a year, 2 years. So we need to be able to constantly be speaking this language until we cleared of this disease. And I think that would be the two most important things, Natalia.
So the training is free, Lee, and the premium version of the app is the equivalent of a nice bottle of red wine. So if you can keep away from a bottle of red wine a month and use that to fund the premium version of the COVID app, happy days. There we go. Last question, Lee. Is there an email address that, or can you give us the website address again where people can, if they want to get more information about the Travel Safe, Eat Safe protocols and the program? Can you just reiterate that for us?
Well, the website itself, Travel Safe, Eat Safe, an app and a website, plus the Tourism Business Council website. In our case, the FEDASA website as well has got the link to the app, and I'm certain SATSA and all other associations have got those links embedded on their websites as well.
Yes, indeed. SATSA has a landing page for the Travel Safe, Eat Safe program. And if you have any questions, you're also welcome to send me an email, communications@satsa.co.za. communications@satsa.co.za. I probably won't have the answers, but lucky for me, I know the clever people who do. So I will make sure that we get those answers to you. Right, it's 3:45. I think we've answered all the questions I had and we have received. Ladies, as always, thank you for your time and thank you for sharing the platform with me today. This is very important. In fact, I'm going to put my head on a block and say, this is the most important thing we are going to do as a tourism industry in the next 6 months for sure. So everyone needs to get behind this Travel Safe, Eat Safe program. And I know that everybody who's on this call is supportive of it. So thank you very much for your time today, ladies, and to everyone who joined us. And thank you to ATW for giving us this platform as well. Have a wonderful week, everyone. Goodbye.